Right now, enjoying the outdoors means facing those 90-degree summer temperatures. Dr. Aaron Jones with Summit Medical, signs and causes of heat cramps and heat stroke. He explains more.
July is typically the hottest month in East Tennessee, and a number of heat-related illnesses present during July, other times as well, but especially this time of year. One most common is heat cramps. Muscles don't like it when they're overused or underused. Enough water to function or electrolytes, they can sometimes cramp up. So we see that a lot. Heat exhaustion is another one, and then we don't rarely see, but occasionally patients will have heat stroke, which is very serious.
What are some of the symptoms of these illnesses? Let's talk first about heat cramps. I think people are used to hearing about heat cramps, like if you're, playing sports as a high school student or whatnot. But they can be painful and they can be concerning. What do people need to be aware of in terms of symptoms, and what do they need to do to alleviate the cramps?
Heat cramps typically come on after being outside for an hour. Sometimes, depending on the heat and humidity, it can come on even before that. It doesn't have to be athletes or vigorous exercise, even gardening, walking outside. Those symptoms can come on even with just a little bit of activity. The things to watch out for are typically large muscle groups, typically the legs or calves cramping up, a lot of painful cramping. Some occasional tightness is different, but the cramping, probably need to go inside, make sure you drink some fluids, try to stretch those muscles. Those are some things that they could do if they're experiencing that. But the heat cramping, while it's typically mild and self-limited, sometimes it does require some medical intervention.